No, tonight I was going to talk to you guys about dementia. I thought about trying to talk about other types of dementia besides Alzheimer's disease, and then I started putting this together and I thought this is way too technical and I really need to tone it down. So I think we'll try to stick mostly to Alzheimer's disease tonight. If there are questions, though, for sure, about other types of dementia, absolutely ask the question. I don't have any problem with that at all. And if there's interest, they're not as common, and it is a little more technical to get into those, but we can do that if there's interest. Again, it's a brain thing, and we are filming this. The camera will stay up here, so don't be shy about asking questions. And then I'll try to remember to repeat the question so everybody can hear it, including on the tape. Alzheimer's disease is a subject that I think there's a lot of kind of like myth about, and a lot of folks don't understand what it is. You hear folks say, a lot of times they'll say Alzheimer's disease, or they'll say the Alzheimer's disease. And it's actually Alzheimer's disease. This is how it's spelled, Alzheimer's. It's actually named after a guy who basically first discovered the illness, and his name was Alzheimer. His last name was Alzheimer, so that's where it came from. It is the most common type of dementia. Now, technical term right off the bat, dementia. Dementia is, the first thing we got to think about is how do you, everybody always thinks Alzheimer's, or has a hard time with trying to figure out, is Alzheimer's a type of dementia, or is dementia something separate? Dementia really is well, here's an analogy for you. You know how there are different types of cars? There's Ford, there's Chevy, there's Chrysler, right? They're all cars, but they're different makes, and you guys know that they're different. So Alzheimer's disease is like a Ford car, okay? It's a very common type of dementia. Dementia has different types, though. There can be Alzheimer's, which is the most common, and then there's vascular dementia, and there's several other types that we could go into at some point. Parkinson's disease has one, has a dementia that can be associated with it. So when you think of dementia, it's more of a cluster of symptoms that go together. Okay, and then depending on how those cluster of symptoms, you know, the course of those symptoms and everything else, that sort of determines what type of dementia it is, whether it's Alzheimer's disease or some of the other types. What are the symptoms? What are the core things that we think about with dementia? Everybody knows, well, what's one of the first things you think of when you hear Alzheimer's disease? What type of symptom? Do you guys know?
Memory loss.
Memory loss, yeah, absolutely. The first thing you think of is memory loss. Typically with Alzheimer's, it's a short-term memory loss first. It's stuff that you did yesterday or you know, a couple days ago, but it's not you know, you don't right off the bat forget who you got married to or when you got married or you know, having your kids or anything like that. That's longer-term memory, and that stuff sticks around a little bit longer. So memory loss is one thing, but if you just have memory loss, what's the word for just plain memory loss? Amnesia, right? So it's different. Amnesia is part of dementia, but dementia is more than that. So what else is there with dementia? Dementia is basically, the way I think of it, is it's diffuse damage in the brain. So it's damage in multiple different parts of the brain. And as we've talked about in here before, the different parts of the brain do different things. And there's different circuits and different pathways. If you interrupt some of those pathways, you can have different symptoms, okay? Some of the things besides memory you can see with dementia is sometimes folks will have, and if you guys know loved ones or friends or anybody that has dementia, some of this stuff will click. They have a lot of trouble with language. So they start to have trouble with maybe finding a word that they want to say. They may you know, try to start a sentence and they'll start to say something and then they'll substitute another word that doesn't make a lot of sense in that sentence. And that's because they can't think of the word that they want to say. Another thing is they may not be able to identify something. You hold up, or I show a wristwatch, for instance, to a person, and I ask, what is this? And they can't think of what it is, but they can tell me what it does. They can say, they might say, you can tell time with it, but they can't remember what it's called. So language problems is one of the big symptoms of dementia besides memory. Another one is inability to do something like button the shirt, tie a shoe, operate the microwave, even though they've done that for years. They might forget the thing that, okay, I got to press this button first, and then this button, and this is how I cook oatmeal or whatever. That has to do with a different part of the brain. Another thing that happens is losing like familiar routes. You know, let's say they're driving and they've driven back and forth to work or to family members' home or whatever over and over again their whole life. should be second nature, and all of a sudden they get lost. Now that's a big clue that something's going wrong, something's wrong there. So they lose the ability to sort of tell where they are in space, okay? Those are sort of the core symptoms of dementia. You can see a lot of other stuff too. You can see some of the common things you see is somebody that starts to bounce checks. You know, they kept the checkbook, they paid all the bills, they've done these things for years. All of a sudden now they're starting to get behind on the bills. They're getting notices from credit people saying the bills aren't being paid. Some of those type of things. You can see also a lot of kind of psychiatric symptoms, okay? So things like depression. Depression is very common in dementia. In Alzheimer's disease, about 40% of those folks have depression. And you guys are probably thinking, yeah, I'd be depressed too if I had Alzheimer's. It's not related to it's not just that, okay? It's also related to the underlying damage that's being done in the brain that causes the Alzheimer's. Is the same thing that's causing the mood to be depressed. The person with Alzheimer's disease sometimes has a hard time with judgment. So they have a hard time, I guess, thinking of the consequences of something they might do. They might just do something and not think about the consequences of it, okay? So judgment is impaired with it. Personality changes. Here's a common thing that I see, where you see, let's say, a little elderly lady who has been church-going her whole life and never cursed a day in her life, at least as far as everybody knows. And all of a sudden she starts to curse like a sailor. And everybody's certainly shocked about that, and they can't figure out what's causing that, and then they're taken aback, and there's a lot of embarrassment and such, but it's basically the person doesn't have the ability to, the social graces, I guess, leave. So they're not able to realize that it's probably not socially appropriate to talk about that or to say words like that, okay? It's not their fault. It's a disconnect in the brain. It's caused by the damage, the same damage that's causing the Alzheimer's disease. Other symptoms include psychosis. We haven't talked about psychosis in here. Psychosis is a fancy word for basically when somebody is not able to think in reality. So they might see something that nobody else can see, or hear something that nobody else can hear. That's called a hallucination, and it's a type of psychosis. Another type of psychosis is a delusion. Delusion is a thought that someone has. My spouse is having an affair on me is a really common one. That's a common one with somebody with Alzheimer's disease. My spouse is having an affair on me, even though it's not, it's probably not happening, and very unlikely for it to be happening. A lot of times if you have a caregiver that comes in the home, and a lot of times, you might have let's say let's just use for example, the woman who has Alzheimer's disease, and the family and the husband have somebody come in to the home to try to take care of, and it's a woman, of course, that comes in to take care of this woman who has Alzheimer's disease, and all of a sudden the patient, the wife, starts to think that this caregiver is having an affair with her husband. Well, they were in the room together, I saw them, and things like this, and so that's a delusion, typically, I guess, unless it really is happening, but typically it's not. It's usually the person thinks that's happening, and it's not. So that's another type of psychosis. And about 25% of people with Alzheimer's disease will have some hallucinations or delusions in some type of psychosis. One other symptom I want to talk about that really throws people a lot is called apathy. Have you guys heard of apathy? And the reason it throws people is because they get it confused with depression. So I'll get somebody who comes in, they'll bring a family member, they come in, and the mom just sits around all day on the couch. She doesn't want to do anything, ever. She's just content to just sit there. And I think she's depressed, is what they say. Sometimes it's hard to figure out. I mean, it certainly could be, because, we talked last time about depression. It makes you not really want to do things. It makes you lose interest in everything, right? But besides that, depression has other symptoms. You don't have any hope for the future. You really, everything's real pessimistic and negative.